San Diego County's health agency says its lab confirmed 141 cases this flu season, a 156% increase from the same time last year. The flu shot is meant to shield people from various strains of the flu virus, but the Centers for Disease Control and Prevention say this year's vaccine is not as effective in protecting against the flu. Dr. Ellen Rodarte of Sharp Reese Steele Del Mar Family Medicine joins me now to talk about the vaccine. The most common flu virus in the United States right now is known as H3N2. What's known about this virus?
Well, this is the virus that in the past we know this virus, we've seen it before, and our current flu vaccine does cover it, but it is shifting a little bit away from what is covered by the vaccine.
So what do you mean it's shifting? Is it mutating?
Yeah, the influenza virus is really smart, and it keeps the CDC and everyone in medicine on their toes because it mutates, or what we call shifts. So every year the CDC gets together and guesses what we think the most common flu strains are going to be. But sometimes they sneak away on us.
So given these mutations, is it still wise, is it still advisable to get the flu shot?
That's a good question. So the flu shot actually covers you for 4 strains of the virus, 2 A's and 2 B's. So the H3N2 is just one of the 4 that shifted a little bit. So you still get coverage for 3.5, pretty much.
Okay, we were having some debate about this in our newsroom. How long does a flu shot last?
That's a great question as well. It seems to just cover for the season, so 4 to 6 months. So it's good to get every year.
Okay, so given that the flu shot is not as effective as it has been in years past, what should people who tend to develop complications from the flu, like the elderly or the very, very young, do if they get the flu?
So that's an excellent question, and I think that is one of the more important things we want the population to know. If you're one of those folks that gets very sick from the flu or is at risk for hospitalization, so the very young, the elderly, or people with poor immune systems, and that includes folks with diabetes, lung disease, if you get symptoms of the flu, call your doctor. And symptoms of the flu is a fever to 101 or higher and body aches. Call your doctor because we have the antiviral medicine, Tamiflu, that works very well to keep those folks out of the hospital. But the trick is you have to get it in someone within 2 days for it to really work.
And what about side effects of Tamiflu? I know that I actually had to take Tamiflu 4 or 5 years ago, and oh my God, it made me so sick. So does it suit most people?
Some people do get some nausea and vomiting from it, and actually some folks are genetically more disposed to get sick from Tamiflu. So that's why we don't give it to everyone who gets the flu. We really want to just find those folks that may be hospitalized or possibly die from the flu, and we want to give them the Tamiflu. And then we can also give them medicine to manage those side effects. So if the side effect of Tamiflu is some mild nausea, we can give them medicine to keep them comfortable. The key is to keep folks out of the hospital and keep folks from dying from the flu.
Now, do you suggest that everybody gets the flu shot? Because I know there are a lot of people, there are holdouts who say, look, I never get sick, you know, at the most I get sniffles. Should those people get the flu shot?
Well, it's interesting. It used to be that we recommended just the sick folks, or the folks who could get really sick from the flu, get the flu shot, but now we recommend everyone. And there's 2 reasons. One, we don't really know who's going to get very sick from the flu. For example, when H1N1 happened, it was healthy 30-year-olds who got very sick from the flu. But then there's another reason why we recommend everyone gets a flu shot, and it's the Good Samaritan idea. You may not get very sick from the flu shot, or from flu. You may just get a little sick, but enough to spread it to someone who could get very sick. So I tell my patients, if you have a baby in your household or an elderly person, if you have a mother with diabetes, if you're in contact with someone who's on treatment for cancer, you should get the flu shot too, because how horrible would you feel if you gave them the flu and then they ended up in the hospital?
And very quickly, how is this season's flu? I mean, how is the flu season shaping up this year?
Not bad at all. But we usually wait till February.
Okay, Dr. Rodarte, thanks so much for coming on the program.
Thank you.